keep walking with us. Keep walking with us around improving the health and well-being of Aboriginal people in the state of Victoria. We've spoken this week quite extensively with media around the biggest issue for the gap between Aboriginal and the Torres Strait Islander people and the rest of Australian society, and the disparities there is that the barrier is often racism. The barrier is often cultural ignorance, and the barrier is often that our mob just don't access services quick enough, or when they do access services, they are 4 times more likely to discharge it early without medical advice. And so we need to really address that as a industry and as a society as a whole. So thank you very much for your time today. Thank you.
Sweet here from Croakey, and I'd just like to say thank you very much for acknowledgement of country and also for making us welcome here at that show. It's a real honour to be here, and like to acknowledge and thank everyone else who's gathered. I must admit we're a little bit overwhelmed by the numbers. We heard there was catering. We lied, so there isn't. We would really like to say thank you so much everyone for coming out. You know, at Croakey we're very passionate about health and health equity, social determinants of health. And so here I would really like to acknowledge CoHealth for sponsoring this event today. It's the first time any organisation has ever sponsored a Croakey Go, and we really appreciate it, and we also think it's quite brave because it's not a tradition really of health organisations sponsoring public interest journalism, and particularly innovation in public interest journalism like walking journalism. So thank you to everyone. I would also like to acknowledge traditional owners, elders past, present, emerging leaders, and the beautiful country that we're on and have the privilege of walking on. So we have a tradition. Croakey Go is walking journalism. It's about collaborative, participatory journalism. So we're trying to build a collective platform for you all to contribute, have your voices heard in health debate, and particularly around matters such as health equity. So we have here, I would like to introduce Mari McInerney, one of the Croakey editors, Dr. Ruth Armstrong, one of the Croakey editors there. I'd also like to acknowledge Rebecca, who is, we rope her into Croakey events because she's such a wonderful journalist, so thank you. And Paula, where's Paula? Anyway, Paula O'Connell is also here from Croakey. There's Paula, just coming there. So just so that you know who we are, and if you want to come and talk to us as we walk, we'd be really appreciate it. We also really encourage you, if you have your phones with you, please take photos, please tweet, put it on Facebook, put it on Twitter, put it on Instagram, put out some messages with your photos as well. So really, we are already trending nationally. We're very pleased to say, Croakey Go, because we've been tweeting up a storm this morning. But you know, it is actually about amplifying voice and having collective impact. So the more you can engage and participate, you know, the stronger our voices will be. So we have a tradition of beginning with going around the circle and asking people to introduce themselves. Because we've got such a big group, we're going to actually have 3 people doing this at once rather than going around the whole group.
Huh?
Yeah, so yeah. Mari, you're going to start over there, Ruth's going over there, and I will come over here.
Oh, and does everyone know it's hashtag Croakey Go and hashtag Big Votes?
Yes, thank you.
So I'm going to hand a little microphone along if we could. So, Nick, we just spoke.
Yep.
Could you introduce yourself again?
So, Nicole Lee, and I'm a survivor advocate of violence and a woman living with a disability, and currently a candidate for the upper house in the southeast metropolitan region for the Victorian state election.
So it might be a bit obvious, but what's the public health issue on your mind at the moment ahead of the Victorian election?
Violence against women is the main public health issue on my mind ahead of this election.
Thank you very much.
Thanks.
Well, who have we got here?
Hello.
Would you like to introduce
Sure.
yourself, madam?
So I'm Lynn Morgaine, and I'm Chief Executive at CoHealth, and It's an absolute privilege and a pleasure to be co-hosting today.
We are very honoured that you've done that.
Yeah,
Thank
it's
you.
really exciting and it's just amazing to see how many people are here. I too want to start by acknowledging traditional owners, and I'm really happy that we've been able to start the tour here at Varcho and acknowledge the leadership of Aboriginal organisations in building communities and networks, particularly in this part of the woods. And I guess the key election issue for us really is around both standing with community health, but more explicitly than that, getting an equity lens into health policy generally. That's our bag, that's what we want to see happen. And this is a beautiful way of illustrating both what communities are doing for themselves, but also what help could be offered.
Are we seeing any signs of that health across all issues from government and opposition here?
I don't think we're yet at a point where we can be talking about health in all policies, but I do think there have been some really important shifts in certainly state government policy around equity populations, and I don't think we've yet seen that come to the fore specifically as it relates to community health and health systems. But I do think that at a policy level there are really promising conversations about the fact that we do need to better target care and we do need to better acknowledge the social circumstances in which ill health arises.
Fantastic. Thank you, Lynn.
I'll give you back your little microphone.
Thank you. I'll just wave it around.
Yay.
Thank you very much. May I interrupt you?
Hi, Murray.
How are you?
Yeah, good.
Can I just hand over the mic? I'll keep that
Which
one.
one?
If I
Okay.
may. Could you introduce yourself, please?
Yes, I'm Tony McBride.
Hello, Tony McBride.
Hi.
We know you very well at Croakey.
Well-
Can you tell everybody else why we know you?
I used to be the chair of the Australian Healthcare Reform Alliance, but I'm on the National Oral Health Alliance and spokesperson for the Victorian Oral Health Alliance. So I've been very involved in advocating in the last year for better public dental care, not in terms of quality, but in terms of funding, where only 16% of those eligible can actually have treatment in a year, because that's all the funding there is.
And how are we seeing that line up in the state election here?
Well, we've met 18 politicians in the last 2 months, and we've had a Facebook campaign, and I guess hard work with oral health, because it's never seen as one of the major priorities, but actually has quite big impacts on people's lives. Anyway, we're hopeful there'll be some movement. I think politicians are recognising that it's an issue, but whether we can push them over the line to actually double the number of people seen, which is our policy proposal, don't know.
Fantastic. Thank you, Tony. Thanks for coming.
Pleasure.
Would you mind passing on? It's like something out of a book we all grew up on, isn't it? Passing the conch. Could you introduce yourself?
Hi, I'm Fron Jackson-Webb. I'm Deputy Editor at The Conversation. Hi.
And a great
Health
friend of
Editor as
Croakey.
well. And a long-term supporter of Croakey. Okay, so my public health interest today, I guess it's really about kind of listening and trying to work out what the key issues are to present to voters ahead of next Saturday's election. Just trying to kind of consolidate and work out, what the big issues are and what readers need to know.
Fantastic. Are you getting any hints at the moment?
It's been quiet. I think we're really noticing the hollowing out of newsrooms in Victoria. But I was really pleased to see the announcement about pads and tampons for high school girls.
Fantastic.
Yeah.
Thanks, Ron.
Thanks, Mary.
Fantastic to have you here.
Now, could explain. I've got a number of roles, but I'm also a public servant, so I'll probably best.
Shouldn't be on the thing, eh? Welcome, and may I pass you by? Thank you.
Okay. I'm going to wing it, I guess.
I'm just going to wander around so you're not in the sun.
I'm going to say similar, something like that. Okay. Ready?
Yes, please.
Okay.
Yep.
Hi, my name's Phoebe Roth. I'm here for The Conversation, where I'm an assistant health and medicine editor, and I'm also a student doing my Masters of Public Health at La Trobe Uni. I am interested in how healthcare is looking after culturally and linguistically diverse communities. I know that's a huge, broad area, but specific things that might be of interest would be culturally appropriate resources, which we know can go a long way to improving outcomes for minority groups, migrant refugee groups that are living here in Melbourne, Victoria,
and anything
Australia.
Particularly with the election in mind?
Everything.
I'd
just today I'd love to get some clarity on what each of the parties are doing regarding health in the election. I feel like I've got a bit of catching up to do. I've been absorbed with finishing off my masters and I haven't kept abreast of all the issues, so it would be great to get a good picture today ahead of voting next weekend.
Fantastic. Thank you so much for coming.
Thank you.
Pass the mic on.
Yes.
So there you go. Could I ask you just to hold
Yes,
that?
sure.
Stick that in my pocket. Okay. Did I do okay? Okay, good.
Hi.
Do you want me to... Hi there, I'm Liz Reddy and I've come along today and excited to be part of this initiative today. I'm actually a student studying public health and so I have a real interest in this area. I guess part of the things I am really interested in is the idea of prevention and how I've come to understand the government doesn't spend as much on prevention as it should, and the benefit that to the community should they invest in it.
Fantastic.
Thank you.
Thank you so much for coming along.
Thank you.
I'm going to steal the mic off you. Thank you. Coming over here. Hello, Jesuit Social Services team.
Hello.
How are you? Do you want to talk together and hold that between you?
Yeah, sure.
Okay.
No worries at
Could
all.
you introduce yourselves by name and role?
Sure. My name's Elle Jackson. I manage the Worth a Second Chance Youth Justice campaign at Jesuit Social Services.
And my name's Katherine and I'm the Media Relations Manager at Jesuit Social Services.
Fantastic. Thank you very much for coming. Justice is a very big issue in this state election. Can you run through what your campaign's about and what we're actually seeing from the both parties?
Yeah, absolutely. So our campaign's about youth justice reform in Victoria and expanding the conversation in the will of the community around what works in youth justice. Currently we know that both sides of politics are calling for tough on crime responses, and we know that that's not actually works in an evidence-based practice. So we actually want to see evidence-based practice in youth justice and reform that focuses on keeping children out of prison and in the community. Yeah.
And are we seeing any shifts towards that at all from the parties?
Shift towards the
evidence-based
practice. We like to think that as a community we're building a platform to advocate for that change, I think from both sides. And again, our campaign as well, we're a values-based campaign around reform for the community and we're a people's platform for reform and youth justice. So we're sort of calling on creating an authorising environment where both sides of the space, irrespective of who's in government, have the core features of the justice system that we want to keep everyone safe in the community.
What would be one feature that you would nominate as vital?
Yeah, sure. So I think there'd be one feature would be raising the age of criminal responsibility in Victoria from 10 to 14. We believe that primary school age children shouldn't be incarcerated, and we would also see that the new development of the Cherry Creek facility poses a really significant opportunity, if this is going ahead, to actually reform youth justice in Victoria and build that facility based on what we know to be best practice, so small home-like facilities that focus on rehabilitation and education as well.
Fantastic, thanks so much, Elle. Katherine, did you want to talk? I know Jesuits went on or Jesuit Social Services went on an international tour to look at those kind of best practice things. Can you nominate any that stand out particularly?
Yeah, that is true. We did some leaders from our organisation, including our CEO last year, did go to several parts of the US as well as Germany and Spain and parts of the UK as well. I don't know if there was a single standout, but certainly all of the systems we saw were unique in their own way and really effective in their own way as well. For example, in Missouri in the US, the facilities there, youth detention facilities, are really small and home-like. There are no fences, so the young people still feel connected to family and community. There's a really strong focus on education there. A lot of young people in the system achieve high school credits in the system, which means when they leave detention, they're better set up to get a job and contribute to society. So certainly some of those observations from overseas have really informed this campaign, and we would really like to see some of those approaches here in Victoria.
Fantastic, thank you. And it's hashtag worth a
second
spelt out?
It is. Hashtag worth a second chance. So yeah, with second spelt out as the word. And you can also follow us on Facebook, Instagram and Twitter, and we'd love to have your support to sign up to the campaign at www.worthasecondchance.com.au.
Thank you so much
Thanks,
for coming
Murray.
today.